my mask down there, my new mask. Hi there. I'm Randy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department. We're coming to you live on Facebook from our Keeler Memorial Building in downtown Mobile. Here to give you the October 26th update on the impact of the COVID-19 epidemic in Mobile County. Then we have a couple other things to talk about. It's a big week with a new tropical storm and a rather festive holiday coming up this weekend, so we'll get right to it. I know you've seen in the news nationally or globally rather, that the counts of COVID-19 just continue to rise. It's really important that we keep sort of vigilance and perspective that more people have been impacted in the United States, more people have died in the United States than any other country, and there's a lot of COVID fatigue out there. We're all ready for this to be over, but we're just going to have to try to hunker down and keep hanging on and supporting and following those mitigation measures to try to keep our outbreak from spreading out of control. So today for COVID-19 cases in the Mobile County, residents of Mobile County, we have 17,033 COVID-19 reported. 22 were added yesterday, Sunday, 70 on Saturday, and 58 on Friday. We'll talk a little bit more about that big spike that we saw on October 22nd in a minute. So yesterday, 22 new cases of COVID-19 added. So far, 317 have died with COVID illness, and the cumulative number of hospitalizations is 2,246. That was an increase of 7 from yesterday. We are still seeing an abundance of transmission in those younger age groups. So people, young adults, high school aged youth who are out there spreading COVID and likely to be have very mild illness, if any illness at all. But again, we really need you wearing your mask and keeping a physical distance so that you don't unknowingly transmit COVID to someone who might have an underlying medical condition and suffer severe consequences and potentially death from COVID-19. The number of people hospitalized yesterday with COVID-19 was 79. That was an increase of 6 from the day before. We're still, again, hoping that number will stay quite low. Our national numbers are going up. Our state numbers are going up. The Mobile County numbers are going up. We are starting to see our fall surge. And like I said, it's happening in cases. Hospitalizations have remained pretty stable. I think we're in a much better place now to deal with excess complications and death from COVID than we were in early summer. I think statewide there are 400 more ventilators in the state available at area hospitals. We have some treatment options now, remdesivir, convalescent plasma, those sorts of things that seem to make a large difference. We have a mask mandate, which is protecting our critical infrastructure and healthcare worker personnel at our nursing homes and long-term care facilities. Most of them have the capacity for rapid testing now. They could do, at the bedside, where, as 5 or 6 months ago, they didn't even have a relationship with laboratories to get testing. So we've learned a lot. We've gained a lot of capacity over the summer. We're going to be in better shape as we see our fall surge begin, but it is still super important that all of you are doing your part to slow the spread of COVID-19 so that we don't overwhelm our healthcare system, overwhelm our hospitals, and have another large increase in hospitalizations and deaths. So wear your face covering, sanitize your hands, wash them with soapy water, or use an alcohol-based sanitizer. Stay at home if you're sick. Maintain a physical distance around 6 feet from people who don't live in your immediate household. All of those things that you need to do to protect yourself. So just as a reminder, last week on Friday, I talked about the October 22nd spike in the number of cases resulted from a backlog of 2,565 positive antigen tests that resulted from one Mobile County chain, a group of providers who'd been conducting rapid testing since June and had been reporting to the state health department, but not in the maybe exact way that we needed them to. So when this came to everyone's attention, we started working with them internally to have visibility on the number of cases. And last week, the State Department of Health worked out a solution to try to get their test results reported in a way that we could have visibility on them. And that, of course, resulted in a huge spike of cases on the 22nd. But I just want to, of course, our rate has increased because of that. But I just want to point out that all of those, the backlog that processed are all classified as probable cases because they were using an antigen test, not a PCR test. So they process as probable, and you'll be able to see that if you look at the confirmed number of case trends in our weekly report, that things look the same as they had been. So for our weekly report, you can see the rate, because of that dump, has gone up to around 4,000, just over 4,000 per 100,000 people. If you were just to look at the confirmed cases, the number reported daily and the number reported weekly would look about the same, going up a little bit. We know that those probable cases, those rapid test results, in line with our traditional public health surveillance, were mostly in the young adult category. A 74% increase in the rate of COVID-19 case reports among people aged 18 to 24 compared to all other age groups. So again, a trend of that young adult really driving our outbreak. This spike will have an impact on our 7 and 14 day moving average for a few days, but we will see that level out. We are still seeing an increase in the number of tests performed each week and the number of % positive performed each week. These are, again, all indicators that let us know that we have increasing transmission in the community. We had been having a very, very low % positive test rate or % positive laboratory test in Mobile County. It inched up a little bit last week from 4 to 6%. But again, if we look at the % positive laboratory results for the labs that are testing using only rapid results, where they're probably seeing the people who are highest pre-test probability of having COVID, their % positive is up anywhere from 12 to 16%, depending on what laboratory it is. So again, just keep an eye on those trends and help us in every way that you can, please, to try to slow the outbreak. I mentioned on Friday that the ADPH risk indicator that was updated on Friday, Mobile County is back in the red. Again, just want to emphasize that that calculation was done on data that were collected and analyzed before this spike was observed. So this spike on 10/22 had nothing to do with the fact that we were back in the very high risk category. It had to do with our cases are no longer declining over a 14-day period, and our % positive is going up. All right, a couple other things to talk about. One, our emergency management agency and our Mobile County Health Department emergency preparedness staff are at the EMA monitoring Tropical Storm Zeta. So Randy, Mike, Aaron, Latasha, Brittany, shout out to all you guys. Thanks for the hard work that you do. So they are monitoring the storm, listening to the National Weather Service, National Hurricane Service calls, closely keeping an eye on whether it's shifting west or east, having discussions about do we need shelters? If shelters need to be open, where will those be? And Aaron just wanted me to make sure to tell you to plan now, but don't panic. Make sure that you have your hurricane or your heavy rainfall, your heavy weather event kit ready. If you live inside the projected cone of the path of the hurricane, and again, it's a wide path, but plan some sort of evacuation, some place for you to stay that is not in a shelter. We want a shelter to be the very last place for you to stay if you do have to escape high waters or high wind. So please talk to friends, family, to see if you can identify some place to wait out the storm if you are in the cone of the path of that storm. All right. Then once we survive Tropical Storm Zeta, then Halloween this weekend. So lots of tips and tricks to try to keep you safer while socializing. That's one of our new mantras, that as we are moving into the holiday season, into schools being back in place, sports being taken in place, we really are trying to find ways to safer socialize. So Halloween involves, large gatherings, family gatherings, friends, crowded streets, close contact that may put people at increased risk of COVID-19. So there are some alternatives to the traditional sort of trick-or-treating. For example, participating in one-directional trick-or-treating or one-way trick-or-treating, where you don't have people going across the traffic when they're walking up to doors or back, or when they're walking down the sidewalk or in streets. We also want you to, rather than, passing out candy, maybe line them up in individual packets so that, children can easily grab them. If you do have someone passing out candy, make sure they are a healthy young adult wearing a mask, and that they stay at arm's length to drop an individual wrapped candy into a trick-or-treat basket. Just want to remind you that masks are really, really, really good idea, but we're not talking about a Halloween costume mask. That is not an appropriate substitute for a face covering that has 2 layers of fabric. So please do not wear a Halloween mask only, and don't wear a Halloween mask over your face covering. This is a no-no. We want to make sure that kids can breathe easily. So let's just, have some fun decorating your Halloween facial covering this year. Stay at home if you're sick, or if you're on isolation, or if you're quarantining. Again, it's very hard sometimes with little kids. So maybe carry some hand sanitizer with you as you trick or treat. Maybe go to the Mobile Parks and Recreation is having a drive-through event this year at Langen Park on October 31st from 10 to noon for children 13 or less. You must, wear a costume, must have a mask, stay in your car. There'll be lots of partners there to provide a safe interaction for trick or treat for those that want to do it safely. So again, sanitize hands. Don't let all the kids grab in the candy bowl. Just making sure I'm hitting all my points here. Parties should be held outdoors, where face coverings can be worn, and it allows people to spread out to try to facilitate staying 6 feet apart. And I think some of the Alabama information that shares said, outdoor, if you've got to have a gathering, if you're going to do it anyway, outdoors is better, shorter periods of time is better, and fewer people. And again, make your sort of expectation known. Sort of like, when you're invited to a wedding and you're told that, it's for adults only. If you are having people over, make sure that they know that they will be expected to wear a mask. Make sure that people know that you're going to be adhering to the safer at home order, and asking friends and family to respect that 6 feet of distance and wear a face covering, and frequently disinfect your hands. So I will stop there for now. If you have questions and we didn't get to them today, it's been a busy day today at the Mobile County Health Department. Today kicks off the Mchd Employee Appreciation Week. We have a lot of fun activities planned this week. We just want to reiterate how much we appreciate our public health heroes and everything that the nearly 500 employees of the Mobile County Health Department do every day. We celebrate you all week long, the week of Halloween usually, and we're glad that you're with us, and thank you for the hard work that you do. And for the rest of you, we'll see you on Friday.